Imagine a scene. A healthy mix of nuts sits before you, but one of them harbors danger, increasing the risk of liver damage by almost 50%. The point isn't to give up nuts altogether, but to make informed choices, knowing which ones benefit your health and which could harm it. According to a 20-year study published in the esteemed Journal of the American College of Cardiology, one toxic nut may be lurking in every pantry. In contrast, there are 4 types of nuts that can protect the heart, strengthen bones, and support brain function. Many people mistakenly believe that all nuts are equally beneficial. However, this misconception can be costly. Often, older adults, striving for a healthy diet, choose nuts over processed snacks, unaware of the hidden risks. Incorrect nut choices can lead to inflammation, destabilize blood sugar levels, and even interact with medications. It's important to understand that nuts are not just a snack. They are a concentrated source of compounds that can either slow down or accelerate the aging process. Studies conducted at Harvard have shown that older adults who consume the right nuts demonstrate clearer thinking, stronger bones, and healthier hearts. Certain compounds found in nuts can penetrate the blood-brain barrier, protecting the brain from age-related changes. They provide the body with minerals needed to maintain bone mass and healthy fats that support artery elasticity. At the same time, some nuts contain hidden carbohydrates that raise blood sugar, toxins that overload the liver, and inflammatory compounds that exacerbate joint pain and heart problems. During natural age-related changes, every dietary choice becomes especially important. Therefore, instead of completely excluding nuts from the diet, it is necessary to understand which ones meet your individual needs and help maintain health and independence for many years. First on the list of beneficial nuts is almonds. They have earned a reputation as one of the most complete plant-based foods, especially for older adults who need strong bones, clean arteries, and cell protection. Each serving of almonds contains about 97 milligrams of calcium, which is comparable to a quarter cup of milk. Almonds are also rich in magnesium, which plays a key role in calcium absorption, ensuring its delivery to bones and preventing accumulation in soft tissues and arteries. This synergy of calcium and magnesium supports skeletal strength without increasing the risk of cardiovascular disease. According to research by the National Osteoporosis Foundation, almonds are especially valuable for older adults due to their antioxidant activity. Almond skins contain flavonoids, which, combined with vitamin E, form a powerful antioxidant shield, reducing oxidative stress associated with cellular aging, memory loss, and weakened immune function. Vitamin E also supports skin health and may help maintain memory function with age. To support the cardiovascular system, almonds contain about 9 g of heart-healthy monounsaturated fats per ounce. These fats help lower bad cholesterol, LDL, while supporting good cholesterol, HDL, which promotes healthy arteries and improves overall heart function. In addition, almonds contain about 3.5 g of dietary fiber per serving, which promotes regular digestion and supports cholesterol control. Second on the list is walnuts, which are rightfully considered the brain-saving nut. Its brain-like shape is no coincidence. Walnuts contain about 2.5 g of alpha-linolenic acid, ELA, per ounce, a type of omega-3 fatty acid that plays an important role in maintaining the structure and flexibility of brain cell membranes. For older adults, these fats are especially valuable because they help maintain signal transmission between neurons and protect against age-related neurological decline. Research from Tufts University has shown that the omega-3 content in walnuts can help maintain cognitive flexibility and information processing speed in older adults. Walnuts also contain polyphenol and vitamin E, 2 compounds with strong antioxidant properties. Unlike many antioxidants, the polyphenol in walnuts can penetrate the blood-brain barrier, reducing inflammation directly in nerve tissue. This is crucial, as chronic low-grade inflammation is now recognized as one of the driving forces behind conditions such as Alzheimer's disease and cognitive decline. In addition, walnuts contain small amounts of melatonin, a hormone that regulates sleep-wake cycles. This can be beneficial for older adults suffering from sleep disturbances, which negatively affect mental acuity and overall well-being. Third on the list of beneficial nuts are pistachios, a pressure balancer, essential for heart health. These small green nuts contain a balanced combination of plant-based protein, healthy fats, and powerful antioxidants, while remaining relatively low in calories, about 160 calories per ounce. Pistachios are especially valuable for older adults due to their high potassium content, about 285 milligrams per serving. This high potassium to sodium ratio helps neutralize the blood pressure-raising effects of sodium, which is especially important for people with hypertension. Clinical studies published in the American Journal of Clinical Nutrition have shown that pistachio consumption is associated with a significant reduction in systolic blood pressure. In addition to cardiovascular benefits, pistachios also regulate blood sugar levels. They have a low glycemic index and contain a favorable combination of protein, fiber, and healthy fats that slow down carbohydrate absorption when consumed with food. This can prevent blood sugar spikes after meals, making pistachios a smart choice for people with type 2 diabetes or insulin resistance. Pistachios also support vision and brain health due to their lutein and zeaxanthin content, carotenoids that protect the macula and reduce the risk of age-related macular degeneration, a leading cause of vision loss in older adults. Emerging research suggests that these compounds may also play a role in maintaining mental acuity later in life. And finally, fourth on the list of beneficial nuts is the Brazil nut, a thyroid and immunity booster that requires careful dosing. Brazil nuts contain an extremely concentrated source of selenium, a trace element that plays an important role in thyroid hormone activation, immune function, antioxidant defense, and cognitive protection. Just one large Brazil nut contains about 96 micrograms of selenium, which exceeds the daily recommended dose for most older adults. This makes them more of a therapeutic supplement than just a snack. Selenium is essential for converting thyroid hormone T4 into its active form T3, which regulates metabolism, energy production, and mood. It is important to note that when taking medications for thyroid, blood pressure, or statins, it is necessary to consult a doctor regarding the choice of nuts. Thyroid problems often arise after age 60, especially in postmenopausal women, and their symptoms, such as fatigue, weight gain, and forgetfulness, can be mistaken for other conditions. Moderate consumption of Brazil nuts can help support hormonal balance. In addition to thyroid benefits, Brazil nuts contribute to neurological resilience. The selenium they contain is involved in protecting neurons from oxidative stress. Low selenium levels are associated with increased cognitive decline. Studies show that improving selenium status can support clearer thinking, better memory, and mood stability in older adults. However, Brazil nuts require caution. The high selenium content that makes them beneficial can also pose a risk if consumed in excess. More than 2 Brazil nuts a day can lead to selenium toxicity, causing symptoms ranging from fatigue and gastrointestinal upset to brittle nails, hair loss, or nerve dysfunction. For most people, 1 Brazil nut a day is sufficient, and 2 only on rare occasions. After considering the beneficial nuts, it is necessary to pay attention to those that should be limited. Understanding the risks associated with certain types of nuts can be even more important than knowing about the beneficial properties of others. Information about hidden toxins, blood sugar spikes, and drug interactions can prevent serious health problems that often go unnoticed. We will discuss 4 nuts that can negatively affect health. This does not mean that they are harmful in themselves, but for older adults facing specific health problems or taking multiple medications, these nuts are associated with serious risks that may outweigh their potential benefits. First on the list of nuts to limit is peanuts. Despite their popularity, peanuts carry health risks that are often underestimated. Unlike true tree nuts, peanuts are legumes that grow underground, making them particularly susceptible to contamination by molds that produce aflatoxins. Aflatoxins are potent carcinogens that can damage liver cells over time. Even chronic exposure to low levels of aflatoxins has been linked to liver problems and impaired immune function. Older adults are more vulnerable to this hidden threat, especially those with weakened liver function or impaired detoxification systems. According to research by the American Liver Foundation, peanuts are also a major source of omega-6 fatty acids. While omega-6s are not harmful in themselves, an imbalance between omega-6 and omega-3 fatty acids contributes to systemic inflammation associated with arthritis, heart disease, and cognitive decline. Most older adults already consume too much omega-6 from processed foods, and peanuts only exacerbate this problem. Second on the list is cashews, which can cause hidden blood sugar spikes. Unlike most tree nuts, cashews are rich in carbohydrates, containing approximately 9 g of total carbohydrates per ounce, with only about 1 gram of fiber. This increased net carbohydrate load can raise blood sugar levels faster than other nuts, which is dangerous for older adults with prediabetes or diabetes. In addition to their glycemic impact, cashews pose a risk due to their oxalate content, natural compounds that can bind with calcium in the digestive tract, leading to kidney stone formation in susceptible individuals. For older adults with impaired kidney function or a history of urinary stones, cashews may exacerbate existing risks. Third on the list of nuts to limit are macadamia nuts, which are a calorie bomb that puts stress on the system. Despite their appeal, macadamia nuts create more disadvantages than advantages. One of the biggest problems is their extreme calorie content. Just 10 to 12 macadamia nuts can contain about 200 calories, mostly from fat, while providing minimal protein or fiber to create a feeling of fullness. Macadamia nuts are distinguished by their high saturated fat content among commonly consumed nuts, almost 3-4 g per ounce. Excessive consumption can contribute to increased levels of bad cholesterol, LDL, worsening existing cardiovascular diseases in older adults who are already monitoring heart health or taking medications such as statins. The rich fatty nature of macadamia nuts also put stress on the gallbladder. For people with known or hidden gallstones, a condition that increases with age, macadamia nuts can cause digestive exacerbations, nausea, abdominal pain, or even gallbladder attacks after eating fatty foods or snacks, especially in large quantities. And finally, fourth on the list of nuts to limit are pine nuts, which pose an aspiration hazard and interfere with medication intake. Despite their exquisite appeal, pine nuts are associated with several disturbing disadvantages for older adults. One of the most peculiar effects is pine mouth syndrome, where some people develop a persistent metallic or bitter taste within 1 to 3 days of consumption, which can last for days or weeks. While not physically harmful, this effect can suppress appetite and cause unintended weight loss in older adults, a group already prone to malnutrition. More seriously, pine nuts contain compounds that can interfere with common medications, including blood pressure medications, antidepressants, and cholesterol-lowering drugs. These interactions are not always documented in major guides, making them particularly dangerous for older adults taking multiple prescriptions. Pine nuts also pose an aspiration hazard due to their small size and slippery texture. They are easily accidentally inhaled, especially among older adults with swallowing difficulties or dry mouth due to medications. When aspirated, these tiny nuts can block airways or get stuck in the lungs, which can lead to aspiration pneumonia, a serious condition in older adults. For practical application of this knowledge, it is recommended to conduct a Sunday audit, stock up on almonds, walnuts, pistachios, and Brazil nuts. Serve nuts in small containers rather than from the package, and store peanuts, cashews, macadamia nuts, and pine nuts in a separate treat jar. High-fat nuts, such as walnuts and Brazil nuts, should be stored in the refrigerator to prevent rancidity, as rancid fats can turn beneficial compounds into harmful ones. As for Brazil nuts, limit yourself to 1 a day, 2 at most, to avoid selenium toxicity. Research from the American Heart Association shows that older adults who follow structured dietary guidelines demonstrate better cardiovascular outcomes, more stable blood sugar levels, and improved cognitive function compared to those who make random food choices. The key to success is consistency, not perfection. It is recommended to discuss nut choices with your healthcare provider, especially if you're taking medication for blood pressure, diabetes, or thyroid conditions, as some nuts may enhance or interfere with the effectiveness of medications. A doctor can help optimize both nutrition and treatment plan. Knowing which nuts to choose and avoid is crucial for protecting health, but overall eating patterns remain the most powerful tool for healthy aging. It is necessary to work with your healthcare provider to create a comprehensive nutrition plan that includes appropriate nuts along with other foods that support bone health, cardiovascular function, and cognitive abilities. Regular monitoring of blood pressure, blood sugar, and cholesterol will help see how dietary changes affect biomarkers. Also, pay attention to energy levels, sleep quality, and mental clarity, which serve as indicators of how well dietary choices support overall health. Choosing nuts is a powerful tool that can either support or undermine health goals, depending on which ones are chosen and how they are consumed. The difference between thriving in later years and struggling with preventable health problems often comes down to making informed decisions about seemingly simple things, such as choosing which nuts to keep in the kitchen. Now, with knowledge, you can choose nuts that actively support cardiovascular health, cognitive function, and overall well-being. Now, armed with knowledge about the beneficial and harmful properties of various types of nuts, you can make informed choices that will help maintain health and independence for many years. Remember that pine nuts pose an aspiration hazard due to their small size and slippery texture, especially for older adults with swallowing difficulties or dry mouth. For practical application of knowledge gained, it is recommended to conduct a Sunday audit of your supplies. 1. Stock up on almonds, walnuts, pistachios, and Brazil nuts. 2. Serve nuts in small containers, not directly from the package. 3. Store peanuts, cashews, macadamia nuts, and pine nuts in a separate treat jar to limit their consumption. 4. Store high-fat nuts, such as walnuts and Brazil nuts, in a refrigerator to prevent rancidity. Remember that rancid fats can turn beneficial compounds into harmful ones. 5. Limit Brazil nut consumption to 1 per day, 2 at most, to avoid selenium toxicity. Research from the American Heart Association confirms that older adults who adhere to structured dietary guidelines demonstrate better cardiovascular outcomes, more stable blood sugar levels, and improved cognitive function compared to those who make random food choices. The key to success is consistency, not striving for perfection. Feel free to discuss your nut choices with your healthcare provider, especially if you're taking medications for blood pressure, diabetes, or thyroid conditions. Some nuts may enhance or weaken the effect of medications, and your doctor can help you optimize both nutrition and treatment plan. Remember that knowing which nuts to choose and which to avoid is an important step towards health, but overall healthy eating principles remain your main ally in maintaining vitality and longevity. Together with your doctor, develop a comprehensive nutrition plan that includes beneficial nuts in combination with other foods that support bone health, cardiovascular system, and cognitive functions. Regularly monitor blood pressure, blood sugar, and cholesterol to assess the impact of dietary changes on your biomarkers. Pay attention to energy levels, sleep quality, and mental clarity. These indicators reflect how well your dietary choices support overall health. Remember that today's snack can strengthen your health in your mature years or subtly undo years of effort. The choice is yours. Nuts are a powerful tool that can either support or undermine your health goals, depending on which types you choose and how you consume them. The difference between an active and fulfilling life in mature years and struggling with preventable health problems often lies in making informed decisions about seemingly simple things, such as choosing which nuts to keep in the kitchen. Now, armed with knowledge, you can choose nuts that actively support heart and vascular health, cognitive function, and overall well-being. You also know which types to avoid or strictly limit. This information will help you maintain independence and vitality for many years. Now, armed with knowledge, you can make informed choices that will help maintain health and independence for many years. Armed with this knowledge, you will be able to make informed choices in favor of those nuts that will support your health and longevity. Having this knowledge in your arsenal, you can choose nuts that will become your allies in maintaining health and active longevity.